I am Ubaid Ullah Kalim. I come from University of Turku. We are studying early gene expression and epigenetic changes associated with progression of type 1 diabetes. In the year 2019, we identified gene expression changes associated with progression of type 1 diabetes before autoantibodies. So when the children progress to type 1 diabetes, before clinical disease, they develop autoimmunity against beta cell antigens. And these are the current markers for monitoring the progression to disease. But the problem with autoantibodies is that by the time autoantibodies appear, maybe the disease process is already much farther in place, and maybe there is very little chance for interventions. So we wanted to study before appearance of autoantibodies, and we identified gene expression changes including high expression of IL-32 cytokine in children who are progressing to disease versus those who are not progressing to disease. And after that, we have also reported DNA methylation changes. So we studied cord blood DNA methylation changes, and we did not find any differences associated with progression of disease in cord blood of children who are progressing versus those who are not progressing. But soon after birth, we have seen DNA methylation differences before appearance of autoantibodies. So both DNA methylation and gene expression changes could be seen before appearance of autoantibodies, and these early detection will give longer time window for interventions and will also help us in stratification of patients. Immunology is a branch of medicine which has helped human being in terms of life saving much more than any other field of medicine, because if you think about historically, the vaccines have contributed to human health much more than any drug or anything else. So I think to study the immune system is very important in many diseases, not only in infections but also, for example, in cancers. So in cancer therapy, when the drugs were used, so the cancer was relapsing because it was developing resistance, and also with infection, the bacteria developing resistance to antibiotics. So recently there has been much interest and progress in identifying using immunotherapy to treat cancer, because then in this case you are dealing not with the pathogen, but you are dealing with the immune system, and so the chances of disease resistance and relapse is less. Yes, I'm sure it will benefit the public health. For example, what we have identified the gene expression changes and epigenetic changes. So these could be, as I said earlier, these could be used for if confirmed in larger and independent cohorts, then these could be used for identifying a suitable set of patients for clinical trials, because in clinical trials you cannot recruit a huge population of people, and you need to do that. If you take from general population for a disease, then one needs a very large cohort to find some differences. But if you want to study, if you could make a smaller set of patients who are likely to benefit from a given therapy or trial, then you increase the statistical power, and you help in minimizing the resource you need to run the trial. So you need to recruit much less people, which is more feasible for running the trial. So I think these early detection will provide longer window for intervention, and will provide also stratification for people to put on a given trial.